All right. So for the next syndrome we'll be looking at is the trying to check something. Okay, I actually left the chewing gum. That's the word Dandy-Walker syndrome. Dandy-Walker syndrome. Okay, so coming. I'll be talking about this syndrome is we'll have a lot of pictures for what illustrations. We see that in the Dandy-Walker syndrome, the corpus callosum may be abnormal or absent. There could be cyst formation in the cerebellum. Your fourth ventricle will not be normal, it will be enlarged. And the cerebellum will be abnormally formed. Hence, because it is big, it will compress the brainstem. Okay. Dandy-Walker syndrome. So it's also known as what Dandy-Walker malformation. It's a rare congenital brain malformation that affects the cerebellum and the fluid-filled spaces around it. Characteristics. Everything we have listed here is what we are talking about again. So the Cerebellar Vermis Hypoplasia. So the part of the cerebellum that connects the two hemispheres, as the vermis, is underdeveloped or absent. There's enlarged fourth ventricle. So the fourth ventricle, which is a fluid-filled space in the brain, becomes enlarged. Okay. Posterior fossa is enlarged. So the space at the back of the brain, that's posterior fossa, is larger than normal. Cyst formation, there could be cyst that is formed in the fourth ventricle. Right? The symptoms is hydrocephalus, developmental delays, balance coordination issues. Associated conditions can be what? The person can be also having congenital heart defects, eye abnormalities, intellectual disability, agenesis of the corpus callosum, and skeletal abnormalities. So the exact cause of Dandy-Walker syndrome is unknown, but it's believed that you have some genetic factors, okay, or chromosomal factors actually causing this, right? So it can also be part of some other birth defects, okay? So diagnosis, just like I have imaging here, mostly MRI, CT, they can diagnose it prenatally by doing ultrasound, okay? So treatment is shunt, so ventriculoperitoneal shunt, endoscopic third ventriculostomy, and supportive care. All of this can actually help, okay? So that's E for what? Dandy-Walker syndrome, also known as what? Dandy-Walker malformation.